The Equity Explorer is a new data tool from the Health Quality and Safety Commission. It allows users to see how health and healthcare varies between groups of people and between District Health Board areas of Aotearoa New Zealand. The health conditions that are compared are diabetes, asthma and gout. For each condition, 3 indicators are presented. This Equity Explorer extends our work on the Atlas of Healthcare Variation by testing different methods for highlighting equity and inequity between population groups. The numbers in the Equity Explorer look specifically at the size of the differences between population groups rather than purely presenting 2 different numbers for different groups. Unlike Atlas analyses, the data are adjusted for age, which allows more robust comparisons between particular population groups which have a different age structure. The Equity Explorer was designed primarily for district health boards, primary health organisations, health professional groups, and health-focused non-governmental organisations. However, we expect users will come from a much wider range of agencies and areas. To use the Equity Explorer, use your browser to navigate to the Equity Explorer webpage. This takes you to the main landing page for the Equity Explorer. Here you will find text and commentary about the Equity Explorer, as well as the Explorer file itself. The hyperlinks on the page will take you directly to particular sections, or else you can scroll down the page to find those same sections. These sections include information about health equity, how the Equity Explorer was developed, and some of the findings and limitations. From the Key Findings section on the main landing page, you can also access 3 sub-pages that provide further commentary and context. There is one page for each of the 3 condition groups in the Equity Explorer: diabetes, asthma, and gout. To use the Equity Explorer, you will first need to download the Equity Explorer file itself by clicking on the File link. The Equity Explorer file has 9 worksheets, which are titled near the bottom of the screen. Click on the tabs near the bottom of the screen to move between different worksheets. The first sheet is like a cover page. Use the Contents and Help worksheets to find your way around. The Contents worksheet shows the different information that is available in each of the other sheets. There are hyperlinks here that you can click on to take you to the sheet of interest. The Help worksheet provides guidance on commonly asked questions, including interpreting what the numbers mean. The health conditions that are compared in the Equity Explorer are diabetes, asthma and gout. For each condition, 3 indicators are presented. There are therefore 9 indicators in total. Comparisons are made between 2 types of groups: ethnic groups and groups based on socioeconomic status or deprivation. The third sheet is a summary of the 9 indicators and gives you information on how each indicator was calculated. There are columns that show you the numerator and denominator, as well as additional notes for those interested in the data technicalities. The next 4 sheets each look at these same 9 indicators in different ways. The 2 sheets with by Dhb in the title allow users to see numbers for all 20 district health boards and all 9 indicators at the same time. The first sheet deals with ethnic groups, and the next sheet deals with socioeconomic deprivation groups. Looking at the Ethnic Equity by Dhb's sheet, the first thing to do is to use the drop-down menu to choose which ethnic group you are interested in. The options are Māori, Pacific or Asian. These 3 ethnic groups have each been compared to our comparator ethnic group, which is European and Other. The numbers in the table give you the rate ratio between the European Other ethnic group and the selected ethnic group. A ratio of 1 means no difference, i.e. the 2 groups have the same result. When there is green shading, it means that the selected ethnic group is doing better than the comparator European or Other ethnic group. Purple shading means that the selected ethnic group is doing worse than the comparator European or Other ethnic group. Where there is no colour shading, it means that the difference is not statistically significant. There are 3 indicators with grey shading for all Dhb numbers. This grey shading means that there is no better or worse finding because it is not clear what the ideal number is for that indicator. Across all 4 data worksheets, you can see links to the Contents, Help, and Technical Appendix worksheets from the top right. Each of the 4 data worksheets also has a brief explanation at the top about what the data are showing. The Deprivation Equity by Dhb sheet gives you the same information, except that instead of using ethnic groups as the comparison, It uses socioeconomic deprivation groupings. The ratios here compare the numbers for the least deprived fifth of the population with the numbers for the most deprived fifth of the population. The colour shading is the same across the worksheets. It is important to note that the numbers are not designed as a league table or competition between district health boards. They are useful to compare equity within a district health board as a quality improvement tool. The two Equity Within Dhb worksheets give you a more in-depth look at numbers for a particular district health board. Again, one tab gives you the information for ethnic groups, and the other gives you information for socioeconomic groups. Using the Ethnic Equity Within Dhb worksheet as the example, this time you need to select the indicators, District Health Board, and Year of Interest from the drop-down menus. The tables and graphs change according to the selection. There is also the option of an All of NZ mean in the Dhb drop-down menu. There are several numbers displayed in the tables. The age standardised rate or percentage is given first for each population group. The next column shows the difference compared to the comparator population. Again, the comparator is the European or other ethnic group. The final column shows the ratio between the ethnic group of interest and the European or other ethnic group. Note that gout data are only available for 2012 onwards. For a more detailed explanation of what the numbers mean, you can use the Help worksheet, which has annotated examples. Finally, further information on our data sources and analytical methodology is available in the technical appendix within the Excel file. We are using Northland District Health Board as an example of how to use the Equity Explorer. Using the Ethnic Equity by Dhb worksheet, we can get an overview of how the indicators vary for each ethnic group compared to the European other ethnic group. Highlighting the Dhb row underneath Northland Dhb allows us to easily find Northland Dhb's data without hiding the green and purple colour shading. First, we have selected Māori from the drop-down menu. We can see that Māori are doing significantly better than the European or other ethnic group for the indicator regular ACE inhibitor or angiotensin receptor blocker dispensing. Māori diabetics in Northland Dhb are more likely than European or other diabetics in Northland Dhb to receive angiotensin converting enzyme inhibitors or angiotensin receptor blocker medicines. Māori are doing significantly worse than European other in the indicator asthma pediatric admissions. Māori children have a 2.33 times higher rate of hospital admission compared to European or other children. Overall, Māori and Northland have no significant differences compared to the European or other ethnic group for 4 indicators, are doing better in 1 indicator, worse in 1 indicator, and we have no better or worse finding on the remaining 3 indicators. We can use the drop-down menu to also review Pacific and Asian populations against the European or other population in Northland. Moving to the Dhb Equity by Dhb worksheet, we can see the same colour key and again can highlight the Dhb under Northland for easy viewing. This time there is no drop-down menu. The numbers compare people living in the most deprived fifth of New Zealand to those living in the least deprived fifth of New Zealand. Let's move to the next worksheet, Ethnic Equity Within Dhb. Here we need to choose an option from each of the 3 drop-down menus. We are interested in Northland Dhb, and let's choose the most recent data, 2014. Now we can select each of the 9 different indicators and get more in-depth information. Our example indicator will be diabetes HbA1c testing. First, we can check that the data are showing what we have selected by ensuring that the titles reflect what we want to look at. A brief explanation of the indicator is also at the top. The table shows the data for the 4 different ethnic groups. The first column gives the age standardised rate. In this case, the percentage of diabetics who received an HbA1c blood test in the previous year. The next column gives the difference between each ethnic group compared to the European or other ethnic group. Here, the percentage for Pacific was 84.6%, which was 2.88% lower than European and other. The final column gives the ratio of the numbers, that is, the ethnic group divided by our comparator European or other ethnic group. For Pacific, 84.6 divided by 87.5 is 0.97. None of these ratios are statistically significantly different from 1, so they do not show up with shading. That is, we can be confident that there is no difference between the European or other ethnic group and the Pacific ethnic group. The graph to the right shows the same data as in the first column for all ethnic groups and across all years of data. You can see confidence intervals represented as the vertical bars. If we choose another indicator from the drop-down menu, the titles, explanations, tables and graphs will change to match our selection. The final data worksheet is the Dhb equity within Dhb Worksheet. We will again choose Northland Dhb from the drop-down menu, and let's look at people with gout dispensed NSAIDs but not allopurinol. Again, we have changing titles, explanations and data according to our selection. For these socioeconomic analyses, we have only used 2014 data. This worksheet has a left-hand side and a right-hand side. The left-hand side shows the socioeconomic data for all ethnic groups, and the right-hand side shows the data broken down by each ethnic group. This is because we know that ethnic populations are not evenly distributed across socioeconomic groups. We say that ethnicity confounds the relationship between socioeconomic group and the indicator of interest. That is, differences or similarities between socioeconomic groups may be partly due to the ethnic makeup of those groups rather than deprivation. Looking at the left-hand side, again we have the left-hand column showing the result. Here, the percentage of people dispensed non-steroidal anti-inflammatory drugs, but not allopurinol. The middle column shows the difference for each quintile compared to the least deprived quintile, and the right-hand column shows the ratio of these two numbers. We can see that the percentage in the reference group has been suppressed because of small numbers in the least deprived quintile 1 group. Below this table is the corresponding graph that shows the data in the left-hand column. Looking now at the right-hand side of the worksheet, we can see the small numbers of people in the least deprived quintile across all ethnic groups. In fact, because of these small numbers, the graph below the table only shows data for European or other and Māori ethnic groups, and only for quintiles 2 to 5. For more information or to contact us, please return to the Equity Explorer landing page on the Health Quality and Safety Commission website.